Welcome to rePROs Fight Back, a podcast on all things rePRO. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to rePROs Fight Back. On this week's episode, we are going to talk about something we haven't really talked about a lot before, and that's decriminalization. And so to have this conversation, there's just two amazing people that had to be the guests for this episode. So Beirne Roose-Snyder at the Center for Health and Gender Equity and Preston Mitchum from Advocates for Youth. Hey, y'all. Thanks for coming.
Thanks, Jenny.
And apparently I decided I'm from the South this morning, so you're welcome. So since there are two different people, I'll let them each do a quick intro of themselves so you know who's talking when. So, Preston.
Hey, everybody. Preston Mitchum with Advocates for Youth. I'm our senior legal and international policy analyst working on young people's access to sexual and reproductive health and rights.
And hi, this is Beirne Roose-Snyder. I'm the Director of Public Policy at the Center for Health and Gender Equity, and we promote comprehensive sexual and reproductive health and rights in U.S. foreign assistance.
So today we're going to talk about how criminalization drives stigma, harms public health, and violates human rights. So when we talk about criminalization, what are we talking about?
So largely we're talking about criminal penalties, and this exists really across the United States and in the global context as well. So a lot of the things that we're talking about are why criminalization is a barrier, why folks from sex workers to people living with HIV to drug users to folks who seek abortions, why because of criminal penalties, many of folks are marginalized. So are poor, are black and brown, live in the global south. So we're really talking about the barriers that exist that make them more likely to be criminalized and punished by many state statutes and federal laws.
When we talk about criminalization, we're often talking about direct criminalization with a statute that might name the exact sort of violation and penalty, or we may be talking about a set of morality codes or sort of less explicit codes that are used disproportionately or entirely to police only certain sets of behaviors from certain sets of people. And when we're talking about criminalization in this context, we're especially talking about it around sexual and reproductive health and rights, and how criminal codes are used to police consensual sexual behavior between adults. And that's a really important distinction because the whataboutism comes in heavily when you're talking about criminalization, and people start talking about trafficking, coercion, violence, force. All of those things are, even as we sort of think about how we unpack the relationship between public health and criminalization, all of those things are things that we all want eradicated, and we don't want fraud, coercion, force to be part of our own sexual expression or that of others. But what we're really talking about here is the kind of criminal penalties and morality codes that play out for consensual sexual behavior or identity and expression amongst adults.
We see this in a lot of different areas. So do you maybe want to talk about some examples of things that we have already been seeing?
Yeah, so I'll start with an abortion.
Okay.
And so I have a story that I really wanted to have your listeners be aware, and I'm sure people have heard of her, but Preston Patel in Indiana. And so though her conviction was eventually overturned, I do think it's important to bring up because
Absolutely.
It kind of captures feticide laws, abortion, and things that originally the state legislature hadn't intended for what the court used it for. So Preston Patel was convicted and sentenced to 20 years under feticide law, so that's the act of destroying a fetus, and child neglect laws. And this was in Indiana. And so the story is Preston Patel had a baby. The baby was born really small, about less than 1 pound. Purvi believed that the baby, the newborn, had died. And so she, and this is a home delivery, so delivered the baby in a bathroom. And she went and put the baby in a bag, put it behind a target, and this is all public record. And then as she started to hemorrhage, and so as she got to the hospital, the doctors looked at the umbilical cord and said there had to be a birth. And so essentially, where's the baby? Which is how a lot of it starts, really, in the hospital, and really just this stereotypical idea of who has delivered, how did they deliver, which usually impacts a lot of Black and brown women and poor women and poor people generally. Nonetheless, she admitted to birthing this child and essentially told the doctors that the baby had died. The doctors, against her wishes, searched for the child, found the child actually buried, so to speak, with the bag, and then obviously got the prosecutor's office and the police involved, and they determined that they used a test, and they determined that the baby was actually born alive. So the baby wasn't dead, so as Purvi thought. So the court ended up, because of that evidence, the trial court decided that she actually did violate feticide laws and child neglect laws, and then sentenced her to 20 years. So the Indiana Court of Appeals, thankfully, overturned it, saying that the trial court had a gross departure from the meaning of what feticide was for. Like, it wasn't to convict people for this idea of like self-induced or self-managed abortions. That just wasn't the original purpose behind the legislation of it. And they said that even if the child was born alive, the state did not prove that if she had gone to the hospital earlier, that the child would have still survived. And so I bring that longer story just to kind of really talk about the idea of criminalization. And that would have been the first time in the entire country where feticide laws would have been used in a criminal context against this young woman. And so criminalization of abortion happens in many different ways, or just like rearing of children happens in many different ways. And that's just a smaller one. And that's really just domestically too.
I think when we're talking about criminalization of abortion, I think it's so good that Preston sort of started with the U.S. because I think most of your listeners probably have a sense of urgency and a sense of how volatile things are at the state level. But, we have countries in our hemisphere that have entirely criminalized environments. And one of the reasons the Purvi Patel story is so indicative is because we can look at El Salvador and we can see what more systemic jailing of women for stillbirths, for miscarriages, for self-managed abortion. I think there's a huge when we're talking about El Salvador, we often talk about miscarriages and stillbirth, and is really important. But like, women there also self-manage their own abortions, and they also have criminalized abortions, and they have sort of a lot of the same rates of abortion as most other countries with poor contraceptive access, and that's okay too. And what's so important about criminalization as a method of control is that those women aren't differentiated at all. So what you have is criminal law getting involved in really complex obstetric care, and in ways that are always blunt and are always playing out on existing prejudices. So most of the women jailed in El Salvador are poor and rural and ethnic minorities or indigenous women. And similarly, you see immigrant women, you see Black and brown women in the United States who are going to be more vulnerable to those prosecutions, not because they have different obstetric care needs, though in some cases they do because they maybe got poorer early interventions, but that they're actually just more vulnerable to the criminal side of things. And I think, the instinct in all criminalizations that we'll be talking about is to sort of look for the differentiation, why it would never be you, that you wouldn't have disposed of fetal remains or a baby that was born alive. There's such an incentive to do that for our own psyches. And one of the things that's really important to remember about criminalization as a structure is that it's such a blunt instrument. There's a lot of ways that she could have gotten help, and that if she had been able to engage systems that weren't penalty-based, things could have gone so differently. And that's true across criminalizations. Viewing criminal law as the way that we interact with people, especially poor people, vulnerable people, is what leads to so many of these outcomes. And I think as we talk across issues, it becomes clearer how they're all connected in how they play out and lead to very poor public health results, and very, very real stigma that keeps people from being able to even access preventative care or some of the public health decisions that we would, in many cases, as a society, really benefit from.
Yeah, I really appreciate you starting with Prabhi Patel's story, because I feel like often when we talk about decriminalization, particularly around abortion, a lot of the stories we hear are El Salvador, which is important, and talk about how that could become reality here. But often, Prabhi Patel's story is something that people might not be as familiar with. And
I think with Prabhi Patel's story, it sometimes it feels like an episode of Law and Order, to be completely honest. And I remember reading the facts of the story a couple of years ago and was incredibly uncomfortable because I knew how people would read it, and they would read it in ways that was not sensitive to her needs, and just the idea of someone putting a newborn in a bag is already something that people they have a visceral reaction to. And I think the way the media actually hounded on that particular part of the story, for me, was very intentional. And it was intentional to make sure that she did not have any, sensitivity to her or to her story. But, when you're particularly vulnerable and marginalized and have nowhere else to go and have health needs, and doctors aren't really necessarily concerned about those specific health needs, it makes the criminality a lot more attached there. And I think that, I brought up the facts because they are the facts, and their public opinion, their court record. And so that they're really important to know. But even with those facts being the facts, right, like the larger picture is still, why was she in the position that she was in? And that attaches criminality to it naturally versus like in state law. And then they took the Court of Appeals to say, you know what, trial court, you are citing completely wrong from the legislature, which is not something that is necessarily common. So this is actually a unique case, particularly with in light of the overturning.
I'll talk about some of the other sort of criminalizations that Preston and I work on, and that we think it's really important to think about sort of all together within sexual and reproductive health. But I would really highlight that there's a theme, which is the prosecution of most vulnerable and people who are painted or sort of for societal and structural reasons seem less sympathetic. And one of the sort of exercises in empathy is to look at how could we have dealt with this as a society and as a family and as people in ways that didn't involve the criminal law, and also realpolitik, which is it always starts with the most vulnerable, but it never ends there. A lot of the cases we know about only end up getting a lot of public attention because it's a good criminal narrative, and we don't hear about a lot of the ones where it's not the perfect victim or not the sort of perfect villain, because that tends to be globally the stories that people really pick up on. One of the other sets of criminalizations that Preston and I look at in our global work, but it's not far past in the U.S., are the criminalization of LGBTQ persons. In the United States, it came as sodomy laws a lot, and we had a Supreme Court case only in the last 25 years that overturned them. But
sadly, much less. Oh my gosh, 2003.
Oh my God.
It's even more sad. But
so that's wild.
So more like 15.
Right.
But globally, we see this a lot, and I think it's important to note that most of these are English laws and are artifact of colonialism. Some of them are Portuguese or French or other sort of colonial powers. And that's really important because conservative groups will very much talk about LGBT issues as a Western invention and somehow something that the U.S. is propagating to create social division and marginalize LGBTQ persons. But it's sort of always important to hold the line on truth, which is actually sodomy laws, the criminalization and marginalization and definition of LGBTQ persons is really, really a Western narrative, and something we very intentionally added to the criminal codes in Tanzania, in Uganda, in South Africa, in so many of the countries that were colonized. And so that's sort of an important framework, but we're still seeing now, there are many, many countries worldwide that criminalize some aspect of same-sex conduct. We can talk a lot about the harm of this. I do want to lightly note the humor of thinking of sodomy as a strictly LGBTQ thing and not just ways people have sex no matter what their sexual orientation and gender identity is. And oftentimes many of the colonial era laws are either defined using really old language that is a little hard to parse through now, or euphemism, which is sort of hard to deal with on a legal level, or really hones in on men who have sex with men and does not necessarily on paper criminalize sexual conduct between women.
Yeah, I mean, a lot of this really is about identity and behavior based. And I think it's interesting because I do think back to Supreme Court decisions that in 1986, Bowers v. Hardwick in a Georgia statute did ultimately rule that, it was across the board anti-sodomy. So, men weren't having sex, couldn't have, anal sex. Women couldn't have anal sex, which was obviously not the intent of the statute. The intent was the statute to target gay men or bisexual men or men who have sex with men. But in 2003, that was overturned, as Beirne noted earlier, in Lawrence v. Texas, because it was a little bit more discriminatory, and so the court, I guess, wouldn't withstand that. But I do think it's interesting, right, because Beirne makes a really good point, and that is a lot of these laws are really, when we think about how colonialism is exported abroad. I teach LGBT health law and policy, and one of the things that my students always raise, in curiosity, is really about how Africa seems like a more homophobic continent, right? And so the one thing we have to stop and have a brief history lesson on is how homosexuality is actually a normal thing in many countries on the continent, and that homophobia was brought to Africa and to many countries in Africa. And so, it's always interesting thinking about the criminal context and connecting that to broader issues of colonialism, both in Western concepts in the United States. And even though this is not a criminal context, I think about cases like Smug v. Lively, Sexual Minorities Uganda v. Lively, where Scott Lively was literally working with ministers and ministries in Uganda to actually push forward, the Kill the Gay bill, which was obviously both criminal and actually violent because there was this propagation and propaganda of killing gay people, gay and lesbian people. And so, yeah, this definitely exists across the board, both in terms of how the United States and other Western countries work to push forward this anti-LGBTQ propaganda. And so, we've really been working in this context to really kind of demystify what's really happening in other countries and to push forward for the sexual and reproductive health and rights of all.
Yeah, you definitely see the groups that have been really fighting advancement of LGBTQ rights in the U.S. are just taking their work and going and pushing it in other countries. And that's a huge problem.
We'll see a World Council of Families meeting in Russia. It's a lot of planning around how to export anti-LGBTQ law and animosity into countries in Africa, in Asia, in Eastern Europe. It's not an accident. It's a really well-organized attack. When you're talking about sort of my work on sexual and reproductive health and rights and foreign assistance, and Preston's as well, the rights part is the part that Preston and my hearts sing for, but the health part is really important too. Criminalization of a single act like sodomy has huge repercussions for how people are able to present for healthcare, how they're able to engage with their healthcare providers, what they are and are not willing to disclose. And even if people aren't prosecuted under a criminal statute anymore, the level of fear and stigma and really sort of can stay. Right now, there are a number of countries that regularly use forced anal exams to try to prove that that men are gay and have violated the law. The evidence is not there. I mean, even if it was that, but it's like virginity tests. It's not legit medical stuff.
Right.
And what it really is state sanctioned rape. And it is a way to scare people, as a way to torture people. It has been considered cruel and inhumane treatment by UN bodies. Medical bodies are against it. WHO is against it. Everyone knows that the purpose is to scare people and harm them, and to keep them, it keeps them out of care. If you are a gay or bisexual man, or a man who has sex with men, your willingness to go to the doctor to get an HIV test, to get an STI test, to in any way articulate to others what you need in order to live a healthy and happy life is really diminished if there's the possibility that your medical files may be taken by the state that criminalizes, or that your doctor or your neighbors might turn you in. And so it obviously has huge human concerns, but even if you are just taking a sort of realpolitik, very public health only focus, we know that there's really tangible driving people from care and out of health seeking behaviors by criminalizing all of the things we're talking about. But I think I'm thinking about it a lot this week just because of some of the stuff that's going on in Tanzania.
The next one to turn to is obviously something I know is very near and dear to both of your hearts, and that's criminalization around sex work.
So there's such a connection with what Beirne is saying, I think, with sex work and criminalization of HIV too. But to start with sex work, at least, criminal penalties attached to consensual exchange of sex among adults. And so people always are wary when we talk about young people in the context of sex work, which is interesting because WHO and other bodies have actually discussed it. And it's important to note that young people doesn't inherently or necessarily mean under 18, which is what I think the fear is, I'll say. But that's just not necessarily true. And so in almost every country in the world, sex work is in some way criminalized. And so it increases sex workers' vulnerability to actually have treatment and care in need. There's then obviously a connection between sex work and HIV. And on the Hill last week, Beirne and I were there really discussing our work with the Sexual and Reproductive Health and Rights Roundtable, where I think there was a collective gasp and shock when we told folks about Lancet's study that, decriminalization of sex work could avert HIV infections up to 46%. And so it does really show that the criminalization of sex work is the harm, and that, criminal penalties attached to consensual acts is really something that's harmful and impacts particular people. And that's true both here in the United States and in many other countries. I'll say within D.C., in 2017, we introduced, D.C. City Council, through the work of many grassroots organizations, introduced a decriminalization bill, which really focused on the public health needs of people who are sex workers. The bill obviously got halted, and I will say because we needed to do a lot more community engagement work and work among ANCs within the district. And so we are going to reintroduce the bill this year, but instead this time we're actually attaching a lot of the decriminalization aspects to things like housing and making sure that there's actually like these wraparound services. Because it's one thing to decriminalize sex work, it's another thing to actually like insert public health approaches and actual housing to ensure that sex workers may not, if they don't want to, go back to sex work. And so, I'll let Beirne talk a little bit more about that, but there's such a connection between sex work's HIV and all the overarching criminalization issues we're talking about today.
Yeah, so I think the decriminalization of sex work is something that public health people are really aware of, and human rights advocates have a much more split sense of. I think one of the things that's so important to really conceptualize is how criminalization is a barrier to sex workers' health and rights. And as Preston said, you see very similar situation with criminalization around HIV, but also really around LGBTQ, real and perceived sexual and gender difference is, can sex workers tell their healthcare providers what their actual risk is? Can they actually talk about what their needs are? Can they be screened for violence in a meaningful way? So their ability to access their own healthcare and be honest about it in a way that protects themselves is really, really hampered by criminalization. We know in South Africa, the vast majority of sex workers face violence. And this is one of the reasons then people pivot and say, great, we should get rid of sex work. The ways that sex workers experience violence is about, in South Africa, the recent data was about 40% was clients, about 35% was the police, and the rest was their intimate partner, their primary partner. All of those ways, they are unable to access help. Because they are criminalized, their ability, when they go to the police will rape them. Right. They're experiencing 35% of their violence is from the police, and that is absolutely because they have been set up as a set of people who cannot access justice. Right. They cannot access their human rights. They cannot show up at a police station and say, I was raped, because they'll be told, you shouldn't have been doing that. Like, you're a whore. You can't rape a whore, which is a constant refrain from the police to vulnerable and marginalized women, especially trans women who just cannot access justice because we've criminalized them. So if justice is your concern, you have to view criminalization as one of the ways. It's not, as Preston said, it's not the end, but it is an absolutely vital part of people being able to access. I think a lot of people who view themselves as sexual and reproductive health and rights advocates are perhaps very comfortable talking about why criminalizing sodomy is wrong and won't work, or very comfortable talking about why criminalizing abortion is wrong and doesn't work, but don't see the parallels to sex work. They see it as inherently very, very different. And I think what's so important to see there are the threads of what does it mean to criminalize? What does it mean to criminalize acts that are about your body and how your body is engaging in the world and with the criminal system, and whose bodies it privileges. And there are fact patterns that we're uncomfortable with, but that doesn't mean that engaging with the criminal justice system is the right way to provide housing, social supports, create less violence, less social exclusion. I mean, there are real ways to say we say all the time, like, good comprehensive sexuality education, good contraceptive access. Those are the ways you reduce abortion if you're really concerned about it, instead of punishing people. Similarly, good housing, good social structures, and decriminalization are how you reduce violence and exploitation if you really care about that.
You know, and it could be that I am steeped in this field and work in it a lot, but it does feel like the conversation has moved forward. And like, I think the great work that you two are doing and other amazing organizations are doing have slowly started to move this sex work conversation forward. And I know Preston talked a little bit about it last time he was on the podcast. And with a focus group of one, I know he started to convince my mom, which, I mean, you're talking about a wonderful 70-year-old woman from the Midwest. So I think when people hear these things, they can start hearing some of these arguments. And I know it's still a long road, but I do feel like some of those first steps are starting to happen.
Yeah. They are. And, you know, I will say also that we received a lot of positive feedback last week at the Commission on Status of Women in New York City. But I will also say, I mean, to your point, Jenny, I completely agree that I do think many organizations and individuals are moving along, understanding, you know, less about morality, quote unquote, and more about, wow, this actually is a public health approach. And that sex workers will be better with the decriminalization approach. I will also say, unfortunately, too, that, you know, to Beirne's point, last week we received from really people who love the Nordic model, and, you know, so they really believe that.
Hey, Preston, what's the Nordic model?
So they really believe, essentially, they believe that, you know, you should be able to criminalize the buyer of sex, and that, you know, of course, you should never criminalize the seller of sex. You know, they believe that, true to Nordic models form. And so as we were trying to say, like, no, actually, studies show that decrim of both is better, and, you know, it doesn't reduce. Nordic model does not reduce violence. In fact, it actually increases violence, you know, of sex workers, etc. And then to your point about rape, though, someone actually said that the only way you can rape a sex worker is if you don't pay them. If there was no other form of rape of a sex worker. And I think that is the work that we have to do, realizing, you know, that, you know, sex workers are raped. Sex workers do experience violence, and it's not necessarily connected to payment, you know, and of course that is a part of it. We can have a conversation about what that looks like too, but I think we should also be very careful of just having this conversation of non-payment of sex workers equals theft and not rape too.
Well, and again, I think this goes back to something we're not really talking about today, but is a big part of it, is just conversations around consent. And that need to happen. Okay, anyway, so that's like a huge sidetrack we could go down, so I'm just going to go ahead and skip that and say we've started to talk about, but maybe you want to talk a little more about criminalization around HIV?
Yeah, so this is one that oftentimes it's interesting across sexual and reproductive health and rights. Again, there are orgs that are really comfortable with like a couple of the things Preston and I are talking about and not the others. HIV criminalization is a really significant issue in the United States, and it's one like anti-LGBT laws and a sort of culture that we've exported with some of our global programs and with model laws and in a number of ways. And HIV criminalization started essentially as soon as the epidemic started. It's rooted in stigma, and it's rooted in sort of using criminal penalties to try to force people into health-seeking behaviors, which I think the theme in this episode is you cannot use criminal laws to force people into health-seeking behaviors. It just doesn't work. And we can show that data across all scopes of things. Early in the HIV epidemic in the United States, people talked about quarantine. They talked about locking people away if they were HIV positive. And then a real narrative, and it would be an absolute disservice to suggest that the narrative doesn't come out of U.S. morality around sexuality, homophobia, who did the epidemic impact first, and how did the sort of the rest of particularly Ronald Reagan's party and America respond to it. And so in the United States, it takes the form of criminal laws at the state level. They're usually called HIV transmission laws. They are not ever HIV transmission laws. They are HIV exposure laws, or they are more likely HIV non-disclosure laws. So these are laws specifically calling out HIV, which say, basically, if you have sex and you are HIV positive, you can be prosecuted for, quote, HIV transmission, though in all I'm actually trying to remember what state laws have updated, but you don't have to prove transmission for the most part.
Yeah, nearly all of them that have HIV laws, yeah.
I should say this is tricky for us to talk about in broad strokes because it's done at a state level, so we're dealing with a pie of 50. And so we're trying to make some clear patterns, but you know what you see is this, the core of it is this fear of HIV as so extraordinary that we want a specific criminal penalty that says if you transmit HIV to someone, you will be prosecuted under this statute. Now, what's really, there's like 9 different pieces to unpack there. One is you don't actually have to prove transmission. 2, it treats HIV as so extraordinary compared to any other infectious disease and really comes out of that 1980s mentality around HIV exposure. It's also very much rooted in the idea of people living with HIV as predators. And it's very, very much rooted in a misunderstanding of the science and also just what the per act risk is for HIV transmission. And it conflates awareness of your HIV status with intent to do harm. And that, I think, is one of the things, Preston and I are both lawyers, I think that's one of the most breathtaking things about HIV criminalization is across all of these laws, there's no need to prove intent to harm, which is extraordinary in criminal law. Most of them explicitly say, or the case law since says, knowledge of HIV status is intent.
And that's really important. That is really such an important point, because what that also means is when you're talking about HIV prevention and treatment, right? Like, what is the point of someone actually seeking services around HIV to even know their status? Because at least if they didn't know their status, then you couldn't prove the knowing element, therefore you can't prove that they intentionally transmitted or attempted to transmit, which obviously goes against our entire goal of how to reduce the HIV epidemic.
Yeah, the only defense for HIV criminalization is not knowing your status. Yep. And so in most states, so like it's a huge disincentive to people, particularly people who think they may be at risk. It's a huge incentive to not get tested and not know your status. This is also a place where we see highly political prosecutions, already marginalized population, gay men in criminalized environments, a lot of sort of playing into sexual stereotypes. And again, I don't like to say this because I really, really don't think criminal law should be used as a tool in public health because it's not the right tool. But if you can prove that someone wanted to harm someone else and that the weapon they wanted to use was an infectious disease, in this case HIV, we have criminal laws that will get you there. That's assault, that's attempted murder. I mean, and some of those cases have played out in states where you have a doctor who takes blood from one of his positive patients and injects it into his mistress who's trying to leave him. Yeah, that's a crime. And he was prosecuted under existing criminal law. You did not need a stigmatizing specific HIV statute because of that. Yep. So when you're thinking about that sort of archetypal harm that people are so afraid of, you shouldn't be able to intentionally infect someone and not have there be a criminal penalty. We have an entire criminal law that is able to do that. What the HIV specific criminal laws do is increase the perceived fear of HIV. They really call it out as an extraordinary harm. They're not rooted in science at all. Condoms aren't a defense in most cases. Having an undetectable viral load is not. So essentially the inability to transmit HIV is not reflected in our criminal law. And I will say, as someone who worked a lot of these cases, we are in 2019, and the vast majority of the judiciary in the United States and abroad comes from a single point of view, which is that, and this is across, for the most part, age and political spectrum, the vast majority of the judiciary lives with an assumption that no one would ever willingly have sex with someone who's HIV positive. And that is an unstated presumption that is reflected in all HIV specific laws and the prosecutions that result from them.
Absolutely. Especially that last part. And I've actually had many conversations with folks both on the Hill and just on social media about that. And the idea is literally, who would have sex with someone living with it, knowingly have sex with someone who's living with HIV? Beirne did such a wonderful job, and I just want to highlight a couple of things, and those are just statistics. And so in many states, actually, that have HIV-specific criminal laws, in the book, you also have to register as a sex offender if you are convicted.
Wow, I had no idea about.
Yeah.
Mm-hmm.
In the United States, 34 states have specific HIV laws, and or you can use it as a sentence enhancement. In half of the states, to Beirne's point, there are non-HIV general criminal statutes that you can use. In all the states, you have battery, et cetera, but this one is literally a non-HIV general criminal statute. And I do want to highlight one case, because just to let your listeners know, this is not just, hyperbolic or just random. The story of Michael Johnson, his nickname as a wrestler, he was a college student at Lindenberg College in Missouri. His wrestling name was Tiger Mandingo. And so, he's a black gay man, tall, muscular. And so I think we can already kind of understand why the media decided to use his wrestling name instead of his real name to really talk about him living with HIV in this case. So he was actually sentenced to 30 years in prison for what was called, quote unquote, recklessly endangering four people who he had sex with. Even though, if you actually look at the court record, one or two of them actually said that they knew he was living with HIV. Like, they said that they knew, and they still had condomless sex with him, and they were still able to bring forward their case. So I will say it was overturned later due to a lot of pressure, thankful to an organization called the Counter Narrative Project, Cyril Project, and a few others around the United States that are just really focused on decriminalization of HIV. He will be released from prison this October, but it still goes to say, someone was actually charged and convicted. And also, we're talking about, the courtroom. He had a public defender, which, this is no disrespect to public defenders. They're overworked and underpaid all over the country. But him having a public defender, part of the issue behind it also was that she was overworked. And so it was really tough for her to really dedicate a lot of attention to this huge case. Also, one of the reasons why it was overturned, it's important to note, is because the prosecutor did not turn over what's called exculpatory evidence. And so that's evidence that really would give way to you understanding that he did not actually commit a criminal offense. Mm-hmm. And to the last point about U equals U, about like this undetectable.
What is U equals U?
So really about the idea that you can't transmit if you're undetectable, if you have an undetectable viral load, which I hesitate to always talk about that because it creates a hierarchy of people living with HIV. But it is important to note that scientifically, you cannot transmit HIV if you have an undetectable viral load, but the court does not pay attention to any of that because it just has not.
Man.
Yeah.
Right?
I mean,
exactly.
We haven't even gotten them to pay attention to condoms as a defense.
Exactly.
We're sure not going to get them to pay attention to science.
Absolutely. And in fact, in some states, condoms can be used as a form of evidence that you were intending to have sex. So it just, this is all about a fear of individuals having sex, even if it's consensual sex or just worry. Well, sex is consensual, so I'll clarify that. Yeah. But that's really what this is about: are people having sex and people fearing people having sex.
Yeah. I will say all the high-profile prosecutions, the ones that have gone to trial, have been gay men and have been in fairly conservative states. It's been very media circuses about sort of like what really sort of reinforcing narratives about sexual predation and a lot of early narratives about the HIV movement and about promiscuity and sort of really some hardcore 1980s narratives. I think it's also important to note that the vast harm of HIV criminal laws never ever makes it to the courts. The two places where we actually see the most use of the laws within and outside of the actual courtrooms, one is against prisoners. So HIV positive prisoners can have nearly anything that happens inside prison amplified because they're positive. So you see a ton, and I mean, I really truly cannot name them, and it's very, very hard to get access to the records to be able to name them, let alone to defend them. We have multiple cases of prisoners being beaten by guards in prison altercations or uprisings who were HIV positive. Because they were HIV positive and blood got on the guards, they got an additional 4 to 6 years for HIV exposure of the guards who were beating them.
Yeah, perfect sense.
The vast majority of the people who have enhanced criminal penalties around HIV are already existing prisoners and whose prison systems use their HIV status as an additional tool of control and sort of weaponizing them in attempted murder.
Most marginalized.
Yeah,
right.
Most marginalized, least able to access help.
Yeah.
Similarly, the way women experience HIV criminalization is oftentimes different than how we see the high-profile cases. It's oftentimes used first as a tool of control in intimate partner violence. As Preston said, knowledge of status is not necessarily a defense. So even if you can say my partner knew, that may not actually stop you from getting prosecuted. So for women, oftentimes what they experience is their HIV status and the threat of criminal prosecution as an additional tool used by their abusers to threaten them if they try to leave, threaten to take the kids away, threaten them in other ways, and basically say, well, I'll tell them I didn't know, or you got pregnant after you knew you were HIV positive. In quite a few U.S. states, a woman living with HIV getting pregnant is de facto evidence of a crime. So we also see medical providers in a couple very, very, very sad cases that don't necessarily make it to the court. They certainly don't make it to the appeals court because women have huge social incentive to capitulate or take a plea deal if it gets as far as getting charged. But where doctors say, this woman isn't taking my medical advice, I'm going to threaten to take away her children for child endangerment. Yeah. Or like the way women in the U.S. and abroad experience HIV criminalization oftentimes doesn't make it to the courtroom and is often weaponized around around children, around pregnancy, and around intimate partner violence. Again, totally predictable when we think about it,
Right.
but really important to note. Those high-profile front-page cases, as destructive as they are, is not how HIV criminalization plays out for women most of the time.
So some people are really comfortable talking about some of these topics, but really uncomfortable talking about others. You want to talk about how they all fit together?
All of this is really connected to bodily autonomy and the rights for folks to have access over their own bodies. The other day, I was on a panel, and I'm going to connect it, I promise. I was on a branding panel, and it was about branding in the 21st century and how do you brand yourself both online and in person. So they asked every panelist, what is your brand? What do you want people to know about you? And I said pro-black, pro-queer, pro-ho. And the room kind of
sums you up.
Right. Well, true. And this is like 50 attorneys in the room. And we're pretty respectable in the legal community. And so when I said that, there was laughter, of course, from folks who knew me. And the other people were like, what just happened? And so I actually end up explaining what that meant to me. I mean, pro-black and pro-queer, I think people understand. The idea of pro-ho to me is just so important because to me it's a reclamation of your own body. And so, there are so many rumors and judgments that people make about your ability to have access and control of your own body. And as a survivor, it's really important to me to know that I have control over my own body and that, that's what's most important to me, no matter if I have sex with one person or 100 people or 0 people, right? Like the idea is that I still own that. From so many parts of the world, people do not have access over their own bodies because of states and statutes and just codes and criminal codes. And, I think that's by design, right? And I think it's by design because folks want marginalized communities and other communities to feel like they don't have control over their bodies, that it's owned and controlled by the state. And so, to me, the connected experiences is this is all about sexual and reproductive health and rights and about individuals owning bodily and having access over bodily integrity.
I really agree with everything Preston said. And I think all of these things are about how criminal penalties are used to try to reinforce very specific social views on bodily autonomy and how you should engage with your own body and your own sex life. And so much of the stigma we see is around an unwillingness to talk about sex and an unwillingness to think about sex. And I think we know, and I think you've talked about on other podcasts, that sexual behavior doesn't vary a lot. No matter how conservative a state is, no matter sort of what the social mores are, like there's actual data that majority of people in the world have sex because it's fun.
Yeah. What?
I know. So I had to check this.
Not just for procreation.
I know. No, I actually had to check with our director of policy research, Bergen Cooper, on that because I wanted to be able to say it, and she makes sure that I have a citation for everything I say. And so I actually have a citation for that. And I think it's really important because we do so much whataboutism and we do so much focus both especially globally on the bad parts, right? The disease, the violence, the harm. The majority of sex is had because it is fun. And that is a scandalous thing to say out loud. And I think you see the flip side of that in all of this criminalization is a really clear morality-based perception that we need to criminalize people's use of their bodies and their engagement with their own bodies in ways that reinforce harm. So we want to criminalize abortion to penalize women for having sex because it's fun. There should be consequences, right? We all have heard those kind of talking points. We're very familiar with them. We're going to criminalize LGBTQ behavior because it falls outside of what we think sex should be for.
You should be punished.
You should be punished. Right. HIV, people who are living with HIV have already been punished, and they definitely shouldn't be having sex, afterwards. I think there's some real sort of themes about it, and I guarantee that people have written brilliant thought pieces that Preston and I aren't citing right now. But in the very nitty-gritty of the policy work we do, you see enormous similarities. I think we also constantly see similarities and themes in who it burdens the most.
Absolutely.
And it's always poor women. It's always women of color. It's always immigrant women, whether you're talking about immigrant women in South Africa or immigrant women in Texas. Who is able to access care? Who is able to circumvent, who is perceived as being a good victim or a good patient versus who isn't, who gets prosecuted, who doesn't. All of that stuff is, you have to notice who is constantly facing the burden of criminalization. I think we would be remiss if we didn't specifically call out trans women of color across all of these as who is specifically criminalized in their existence, disproportionately prosecuted and perceived as being sex workers, disproportionately prosecuted around LGBT and sodomy laws across the world, disproportionately harassed, facing police violence that makes them vulnerable to everything. I mean, if you just look at who gets harmed, you have to understand that these are all connected.
Yeah. And that is why all of this is a reproductive justice issue, right? And so, obviously, the sexual and reproductive rights rely on your health, and certainly all of those rely on justice. And so when we're really thinking about how this impacts the most marginalized, we have this, for me, you have to start with trans women of color. And I would obviously like to say for Beirne too, with her previous note, all of this is really about how do you get the most marginalized people and how do you actually make them, as the state perceives them, to be a quote unquote good victim. And so there's so many ideas and so many people who are criminalized and penalized for these statutes and for behavior. And all of that is really because many states led by cisgender heterosexual white men, namely, are afraid of the idea of what other behaviors look like. And so, yeah, I agree with everything Beirne just said. That was really my point to emphasize that about who is most harmed by these criminalization policies and how this is actually connected to a reproductive health rights and justice issue.
Great. Well, it feels like a really good place to stop. But I do always like to ask, what can listeners do to take action on these issues? So since I know you guys, I'm sure, have some suggestions, what can listeners do? In
DC, at least, I would say really look up the Sex Workers Advocates Coalition, look up collective action for safe spaces, look up work that really on the ground folks are BYP 100, work that folks on the ground are really doing to decriminalize sex work in DC. And for folks who aren't in DC, there are still many opportunities to engage with either local electeds and state electeds, right? Because I say everything is local. And so I know, we work both in terms of federal and U.S. foreign policy, but many of this starts on the local level. So definitely feel free to get involved, write op-eds, write your members of Congress. And of course, I'll give the nerdy policy pitch. So make sure to get involved on the ground, but also pivot that to your local electeds and your state electeds as well.
I think it's a really good time to speak to your elected officials about the broad harms of criminalization, not even attached to specific statute, but about how it's not in your interest. Speaking up and just undermining the notion that everybody thinks, we should criminalize sex work, that everybody thinks, it's okay to have HIV-specific laws. I think really engaging with your policymakers and your family on this is a really, really important opportunity. Preston and I work at the policy level. I would actually flag a resource from one of our colleague organizations. Amnesty International has done a whole set of tools called The Body Politics, which includes a lot of research, but also a lot of amazing resources for activists on thinking about how to engage their local, national governments on issues of criminalization across criminalizations. And I think it's a really extraordinary resource, and certainly one that we use. And so I do think that's a really great way to engage in systemic activism and not just plucking off the one you're most comfortable with.
Thank y'all for being here then. Thank you, Beirne. Thank you, Preston. I think this was a great conversation.
Thanks,
Thank
Jenny.
You.
For more information, including show notes from this episode and previous episodes, please visit our website at rePROsFightBack.com. You can also find us on Facebook and Twitter at rePROsFightBack. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.